As the pandemic enters a second wave, healthcare workers are finding it more difficult to manage the pressure of treating the growing number of patients. An ICU nurse in Northwest Baltimore says she and her co-workers are relying on family, friends, and each other for support. WMAR2 News' Mark Roper has more about the nurses' efforts to cope.
Even though doctors and nurses deal with matters of life and death every day, COVID-19 takes a different toll.
You don't get trained for this. I didn't go into nursing thinking, down the line, I'm going to be in the middle of a pandemic. Healthcare workers are resilient. I think that going through this, it kind of just highlights that, the resiliency of the healthcare staff, everyone in the hospital.
We call them our heroes, our frontline heroes, but the fact of the matter is we've been still neglecting them and not treating them as heroes. And they're right, I think, to be expressing these concerns. They're working under extraordinarily difficult conditions, and we're not doing enough to take care of them.
Mental Health America President and CEO Paul Gianfrido recognizes healthcare workers tasked with taking care of others often feel guilty for taking care of themselves.
We have to make it okay for people to take care of themselves and remind them the best way to take care of other people is, in fact, to take care of yourselves. But not just remind them, we actually have to make it possible for them to do it. You can't keep saying, well, you got to pull a 16-hour shift, a double shift, and then come home and take care of yourself.
Although some might find comfort at work.
If you're having a really bad shift, we have, amazing support from our leadership and our teammates. We kind of support each other, lean into each other. We've sort of been through the trenches with each other. So knowing that I'm not only going there to take care of patients, but I'm also going there in support of, my coworkers.
Or to find peace within the hospital, such as at this party for nurses back in May.
We did actually have a tranquility room that was created for us in the midst of the last wave, where little stream going, some aromatherapy, dim lights, a place that if you needed just a second, go there and sit for 5 minutes. So doing those little things, I think, will make a big impact.
Outside the hospital, this ICU nurse has found a few other ways to manage the pressure put on healthcare workers during the pandemic.
Staying in contact with friends and family, Zooming, FaceTiming, venting out frustration and the sadness and the fear that's around it, and kind of just getting that out so I'm not holding it in has been helpful for me.
And while she's thankful for her support from family, friends, and hospital management, this nurse believes the community also could add another level of support by wearing a mask and following other COVID safety guidelines.
It has been deemed that we're the front line, right? Healthcare workers, but we are not. I know this has been said before that the community is the front line. We're the last line, so we really need to work together to do the things that we need to do to reduce hospitalizations, reduce people getting sick.
Which would give healthcare workers a much needed break to focus on taking care of their own mental health.
It really is a sign of strength to understand, where you've got some needs and when you need to rely on other people, because none of us, can do any of this by ourselves. But it's a challenge sometimes with people who are by their very nature, people who give more than they receive.
And what will this nurse do once the pandemic is over?
I'm going to hug people. I miss that. That's one thing. And also to seeing a smile, if we don't have to wear a mask, you really take for granted being able to see someone's face, and see a smile.
The head of Mental Health America says that there are 4 things that can help people take better care of their mental health. First and foremost, information. And second are those do-it-yourself tools to offer guidance. Then peer support and treatment.